Depends on the woman. Some of them have been moving towards this decision for several years now. They study the features of the program for a long time and try to understand the medical part. There is another type of woman. They learn about the program, get excited on the idea, and literally a month later enter the program. Often they come on the recommendation of friends or relatives who were already surrogate mothers. In any case, almost all women have several typical experiences. The first is hormones. For several months, women will have to take medication to maintain their pregnancy, and they want to know if the medication will have a negative effect on their health. The second question that worries everyone is who they will bear the baby for. After all, some still maintain the stereotype that surrogate mothers are used by people who do not want to bear the baby for various reasons, not to be distracted from a career or to experience discomfort during pregnancy and childbirth pain. Of course, all this is not so. Firstly, hormonal drugs are selected strictly individually. Secondly, we tell that this is a program for couples with medical indications, and then women want to provide real help to the family, and this becomes a real boost. Of course, every woman receives a financial reward because she carries physical activity, devotes all her time to pregnancy. Based on the totality of all factors, women make a decision. Legally, no consent is needed, only from the husband. This is another question from a moral and psychological point of view. Of course, everyone is pleased when there is support, but surrogate mothers decide themselves to tell their family about pregnancy or not. I'll tell you an example. Recently, our surrogate mother had a misunderstanding in the family. She told her mother about her participation in the program, and she did not support her. She stereotypically thought that it would be her daughter's own child, and she would give it to strangers. A surrogate mother gave her mother a lecture, how to create an embryo, how it is transferred, how pregnancy proceeds. In general, she explained that this child is not genetically connected with her. The other day, a surrogate mother called with the news. Mom understood everything, is no longer angry, and supports her. Or another recent example. Our client came to her boss at work and said, "I am going to become a surrogate mother. I will have to go for IVF and tests, and at the end of the pregnancy, I will go on maternity leave. After giving birth, I need a little time to recover, and I will return to work again. How would you look at it?" Do you know what he said? Great. If you need support, just ask. But in general, all situations are unique. Anyone who wants to tell friends about the program tells. The one who does not want does not tell. This is a woman's choice. From practice, I know that women often do not talk about pregnancy with children. If the child is small, he may misinterpret the situation, but do not hide from children's eyes too. It is worth acting based on the age of the child. Preschoolers, most likely, will not notice anything if the woman herself does not focus on this. And if the child is interested in the situation, we recommend answering his questions. Do not cheat. Do you have a belly? Yes. Are you pregnant? Yes, I'm pregnant. Will I have a brother? No, you will not have a brother. If the answer is sufficient for the child, he or she will calm down. If not, the surrogate mother keeps answering, but only within the question. You can explain to the teenager the true reasons, even before the start of the program. You can say, for example, "There is a family that has long dreamed of having a baby, but because of the disease, they cannot give birth to it themselves. Now this family asked me to have a baby for them. I don't have a genetic connection with the child. Your dad doesn't. That is, it is not your brother or sister. Doctors took cells from this couple and created an embryo in the laboratory. Then they performed the procedure and transferred the embryo to my belly. I will give birth to this child and return it to the real parents." This can happen with any pregnancy. Sometimes women get tired physically. Sometimes they become very vulnerable morally. I recently had a story. A surrogate mother calls me and, barely holding back her tears, says, "Previously the child's parents called each week, asking how I was doing, whether the child was moving actively, but they have not been in touch for a week. Aren't they interested in what happens to their child? I reassured her and asked to wait half an hour. I understand her feelings well, because every surrogate mother wants to know that parents are expecting a baby. In the meantime, we contacted the parents. It turned out there was no drama. It turned out that the parents were simply afraid to be annoying and decided to take a break in constant calls. That same evening, they called her, and everything made sense. Thus, most worries are resolved if people are not afraid to speak openly with each other. In addition, throughout the pregnancy, we coordinators meet in person and talk on the phone with surrogate mothers to monitor their psychological state. We recommend treating the child as a temporary guest, being polite but not attached. Most call him friend, girlfriend, beauty, boyfriend, or just baby, and if the parents came up with a name, then by name. In general, in psychology there is a direction, perinatal psychology, which is engaged in intrauterine development of the child. It studies how the period of development before birth affects the future development of the individual. It is proved that children who were not expected are lonely, inactive in life. Therefore, it is important for the child to understand what is waiting for him. During pregnancy, only parents and surrogates can give this feeling to him. It is proved that the child in the womb hears everything well. Therefore, surrogates talk with the child about their parents. For example, they say, "Your parents are waiting for you. I will create a shelter for you, and when the time comes, I will give you to your parents. Your parents love you." This happens rarely and occurs when parents and a surrogate mother spoke little during the program. Then it seems to women that the child will fall into the wrong hands of strangers. But we understand that some parents refrain from communicating, not because they are callous. Simply, many of them went through unsuccessful IVF, and some even through unsuccessful surrogacy programs. They are afraid to get closer to a surrogate mother again. They are afraid of repeated failure and disappointment. One must be able to understand this and not be offended by it. Parents are very much expecting this baby. Surrogate is the last chance for them. We always explain it to the women, and they understand. Usually the remnants of experiences disappear with the birth of the baby. A surrogate mother sees how parents are happy with their baby, and gradually everything comes into place. But I repeat, attachment to the child usually does not arise. Women initially understand that the child is a temporary guest, and happily pass it on to their parents.